Janet Helduser and Dr. David McClellan from Texas C-STEP joining us in studio today. Thank you so much. Janet, before we go any further, what is Texas C-STEP?
Well, Texas C-STEP stands for Screening, Training, Education, and Prevention. And we work in the area of colorectal cancer. We want people to know that it is the second leading cause of cancer-related deaths, and yet it's a very highly preventable cancer. There are a lot of lifestyle things that we can do in order to decrease our chances of ever having colorectal cancer.
Sure. Dr. McClellan, when we talk about colorectal cancer, what exactly are we talking about? What does that look like for patients?
Well, colorectal cancer can kind of start with many different types of symptoms: abdominal pain, rectal bleeding, weight loss, things like that. But I think one of the main messages we want to get across is that by getting screened for colorectal cancer, we can remove polyps before they have a chance to turn into a cancer, and so we can prevent much of the colorectal cancer.
Absolutely. Highly preventable seems to be the theme here. So why is this cancer, Dr. McClellan, why is it still so prevalent if it's so preventable?
Because so many people don't get screened.
Simple as that, huh?
So less than half the people who are eligible to be screened get screened every year.
So who are the people who are eligible to get screened?
Well, really the guidelines tell us that everybody age 50 and above should be screened for colorectal cancer. But people want to speak with their doctors individually, because people with a family history of colorectal cancer should have their screening done at a much younger age instead. The number one barrier is cost, though, and that's why we're so proud of our Texas C-STEP program. We have a program that provides free colonoscopies for people that are not insured in 17 counties around the Brazos Valley. We also provide free colonoscopies for people that are underinsured. Perhaps they have insurance, but they can't afford that deductible or copay that sometimes comes along with having a colonoscopy. So people can contact our program to see if they qualify financially to have one of those free colonoscopies.
Because what you're talking about is a costly procedure, and here you are offering it for free to the folks who qualify.
And we're able to do that through the Cancer Prevention and Research Institute of Texas. CPRIT funds this program for us.
Absolutely.
And we're very proud of being able to do that.
Sure, sure. Excellent work there. Dr. McClellan, we talked about, Janet mentioned earlier screenings for folks with a family history. What exactly kind of family history are we looking for? How close do those cases have to be to you?
So if you've had a first-degree relative, a parent, a child, a sibling, a brother or sister who has had a history of adenomatous polyps or colorectal cancer, you should get your screening at an earlier age. And generally speaking, that would be 10 years younger than that person in your family was diagnosed with their disease.
Oh, so a bit of an equation there. So not necessarily just 10 years younger than 50 when you recommend it for everybody, but 10 years younger than the person who was diagnosed.
Right.
Very interesting. I know that it's brand new research that's come out about the younger and younger cases, but would you recommend that anybody with a family history somewhere related to colorectal cancer just talk to their physician?
Talk to their physician, because there are some other familial cancer syndromes that one might need to be screened much earlier for.
Sure,
Right.
sure. How can folks get in touch with Texas C-STEP?
Well, we have a team of community health workers that work with Dr. McClellan in the clinic, and they will answer a lot of questions for you. They'll see if you're financially qualified. They'll address any fears you might have about the procedure and answer your questions. And they can be reached at 979-436-0443 or 0453.
And you don't even have to remember that necessarily. We will put that online for you at KBTX.com, but you are very, very reachable, and a great website as well?
Yes, TexasCStep.org.
That one's easy.
Yes,
right
thank
there,
you.
TexasCStep.org.